Today, I'm going to be making a public service announcement about the education system and navigating students that have the disease of diabetes. While this disease is not necessarily a mentally handicap, it does affect students in their everyday lives and how they go about growing and developing in the school system. So it's really important to be well educated on how to encourage them and push them to succeed while treating them normally at the same time. So first of all, it's important to know what diabetes is. Diabetes is a disease that occurs when your blood glucose level is too high and it causes your blood sugar is too high. There are two main types, type 1 and type 2. There are a few symptoms that you can look for in your classroom. If you kind of notice that your kid is experiencing these things, you can kind of navigate that and maybe get that diagnosed so that he can have the health care that he needs. If your student is hungry, having to use the bathroom frequently, and is tired, all three of those together far more than the average student, then they might be suffering from a type of diabetes. So that is something that you can look for in your classroom every day, just to keep an eye out and make sure that your students are doing the very best that they can. Now, if you have a student and you know that they have this disease, there are a few teaching strategies that you can use in order to keep them feeling safe in their classroom environment. If you have a child with diabetes, never leave them alone. If they are in a situation where they're alone and something goes wrong with their health, then that could be a really catastrophic thing. So it's really important to make sure that they always have somebody with them so that they can be safe and they can feel comfortable in their learning environment. Another strategy would be throughout the day, even while you're teaching lessons, have like a sort of food incorporated into your lesson so that they are never so hungry that they can't focus on what they're trying to do. Another really good teaching strategy in general is to have clear communication with the child so that they can know where you're at and that you can know how they are feeling as well. Another really good teaching strategy is simply to allow periodic bathroom breaks more than normal, possibly, so that the student with diabetes might not feel uncomfortable with asking or simply just having to use the bathroom and being a little bit embarrassed. How to include a child with this disability in the everyday classroom. Simply treat your child the same way that you would any other student. Cause them to feel and help them to feel as normal as possible. Teach them the same way that you would teach a student who does not have this issue. Another way that you can include them in the everyday classroom is to be subtle when you are talking about what they're experiencing. And don't make it like an embarrassing thing that they should feel ashamed of, because it's not something that you should be ashamed of. So if you're subtle about what you're talking about with them, then it will be less embarrassing for them and they'll feel safe and feel capable of learning and growing more and more in their classroom. Thank you.